Yes, guys. So I hope a couple of people have joined now. We'll just wait for one more minute and then we will start it.
Recording in progress.
Okay. Is everybody able to see the screen? Iba, can you tell me the status?
Yes.
You guys are able to see the full screen, right?
Yes, sir.
All right. Fine then, let's start. So good afternoon, everybody. A very warm welcome to all of you joining today. I'm really delighted to see so many of you joining us for today's webinar. Managing arthritis the natural way is the topic of the webinar, and it's my privilege to present and to acknowledge everybody who has participated in this and all my lovely team who has prepared for this. I really thank them to do this.
Hello. Good morning.
Um, Hi, Hanindya. Good morning.
Hi.
Special thanks to Anindya to do the PPTs. All right. So I'm Dr. Vinayak Jyoti, founder of Healing Hands Advanced Physiotherapy Clinic. We started our journey back in 2017, and today with three centers across Bengaluru, in JP Nagar, Jayanagar, and BTM layout, we have had the privilege of helping thousands of people overcoming pain and get back to active and pain free living. So, arthritis is one of the common causes of joint pain today. It affects nearly one out of four adults in India, and it often starts silently with mild symptoms and then slowly progresses, in many instances, even leading to joint replacement surgeries. And this is what we want to prevent. And just last week was World Arthritis Day, and to mark this day, we are doing this webinar. This is basically educational series for our patients, and we are planning to do it every month. There's some topic that we want to do it. So, as you know, the arthritis starts slowly, silently, but then progresses slowly, and often leading to surgeries and very bad conditions. But the good news is, with the right awareness, timely treatment, and with simple lifestyle changes, it can be managed effectively without always depending on long-term medications or needing to go for surgeries even. So today's session is all about how to prevent and manage arthritis. Today, we will be covering what arthritis really is and how it affects your joints, how physiotherapy, movement, and mindful habits can help you stay active for life. So, let's make this a meaningful and knowledge rich session where you gain the knowledge and confidence to understand your body, listen to your joints, and take charge of your long term mobility and wellness. Before we begin, just a few quick notes for everybody who has joined. Please stay us till the end. We have a dedicated question and answer round to address all your questions. So if you have any doubts or queries during the session, just drop them in the chat box and we will take them up at the end. Please keep your mic on mute so that everybody can listen the presenters clearly. So that's about it. Sit back, keep a notebook if you want to keep to note down major points and whatever you want to take back home, and get ready to learn how to take care of your joints naturally and effectively. Over to our experts to get us started. First of all, I would like to introduce Dr. Eba, our chief physiotherapist, to start the webinar with an introduction about arthritis, the types of arthritis, so that you can detect them early on. Over to you now, Eba.
Hi, good afternoon, everyone. I hope I'm audible to everyone.
Yes.
All right. Before we begin on what exactly arthritis is, based on the topic of today's title, Managing Arthritis the Right Way, we will be exploring not just about the treatment, but also the brief detail about what exactly arthritis is, how it actually causes, what are the various factors, and what are the early signs that we can detect and prevent from further deformities or further chronic. Uh, Before we start, to start off, let's first try to understand what exactly arthritis is. Next slide, please. Can I get a next slide?
Just a second. I'm trying to do. Rahul, can you just check if you can do it from your side?
No, I can't.
Yes. So what is arthritis? Yeah, I guess it was all right. Yes. Arthritis is basically a Greek word with arthro meaning a joint and itis means inflammation. So any inflammation at the joint, it could be a single joint or could be a multiple joint that can cause symptoms like pain, swelling, or even tenderness, redness around the joint, and even restriction in the movement or limitation in the functional activities in the chronic stage. This is what arthritis is basically. Now, as you can see in the first picture where it's mentioned as the normal joint. Now, basically in general, all the normal joint, this is how it will look like as a clinical presentation, where it could be a two bones or three bones forming into a joint with the lining, as you can see that white color lining is what we call a cartilage. Now, cartilage will give a cushion-like function to the bones, and the orange color structure that you can see in the center, that is what we call a synovial fluid. Now, a synovial fluid is a fluid jelly-like structure which will help or allow us to perform the movements very smoothly and very freely within the joint. Next slide, please. Next, coming up, we all are very much aware that arthritis is very much common disorder or common disease now in our day-to-day life, which is not also affecting only in India, but also worldwide and in a very much large number, significantly impacting in our day-to-day life activities and also a quality of life. But before jumping into the conclusion of management or either whether to go for a surgery or whether to get treated conservatively, we should also understand in a better way of what exactly arthritis is, how does it cause, what are the early sign and symptom that we can prevent from further or making it more complicated in the further case. Now for that, we can jump into a next slide, please. Now, in this slide, as I mentioned in the previous first picture, the normal joint, This is basically a clinical presentation of an arthritic joint in general, of all over or any kind of arthritic joint. So when the arthritis happen or inflammation happen at any kind of the joint, there it could be because of the infection, it could be because of repetitive stress, it could be because of the degeneration, wear and tear that is happening within the joint. So these all causes or factors can give the same clinical presentation like what you're seeing in the screen right now in the slide. Now that white color structure that you can see is what the cartilage will look like. But in the arthritic joint or arthritic condition, the space between two bone will also become less, from which friction of two structure will are very much prone, from which the structure surrounding the bone will start eroding or the wear and tear will happen. And this is what it will look like, where the clinical sign and symptoms like pain or swelling and the inflammation, that all will start, and then which will also further constrict our movement and also impact on our functional activities. But this is how in general the clinical picture will be looking like in case of the arthritic joint. Next slide, please. Now, as I say arthritis, I'm very much aware and very much likely to say that everyone will be very much commonly known or aware about osteoarthritis. When we say arthritis, the first thing that comes in everyone's mind is the osteoarthritis, which is very much commonly affecting in the knee. But when it comes to arthritis, there are many and tons of type of arthritis that can happen within a different type of joint in our body. But here, which we are going to discuss today, these are the 9 important type of arthritis that can happen in any type of the joint in our body. The first up, coming up with the next slide, please. The first type of arthritis is an osteoarthritis, which is very much common in day-to-day life, and every one of you must be aware also. Osteoarthritis is actually a degenerative joint disorder, which mainly causes due to any degenerative wear and tear that happens within the joint. Now that can cause due to many factors. It could be age related, it could be because of any infection, it could be because of any other disorder. But the main reason that will happen within the joint is the wear and tear. Like how I showed in the previous picture, where all the structures start eroding when the inflammation start happening. It could be of many reasons. So these wear and tear will happen, and the same wear and tear will end up giving a various sign and symptom. For example, mainly in our osteoarthritis, we can see is in a very acute phase, it will be a very much tremendous pain, severe pain. There will be a lot of joint effusion where a swelling will be there around the joint. The muscle surrounding the joint area will become very tender and very painful. But along with that, sensation or the stiffness will start developing, where slowly, if left untreated, your range of motion or the limitation in the movement also will start developing. Same as in the osteoarthritis, the common joint that we can see in the type of osteoarthritis is your knee, your hip, and the spine. And the features or the classical sign or symptoms that we can see is the degenerative cartilage or the breakdown of the cartilage, as I've shown in the previous slide. Second type, please. Second type of arthritis is a rheumatoid arthritis. Everyone must have heard this word rheumatoid arthritis. Now, this is a type of an autoimmune disorder or autoimmune inflammatory arthritis, where it is caused mainly if there is an abnormality within our immune system. So autoimmune disorder is nothing but when own body immune system start attacking their own healthy tissue with the confusion, thinking that the own body tissue is a foreign particles to the body. So they start attacking the healthy tissue of your own body. And when they start attack on the tissue, the reaction will start happening in that particular region. And if such issue or such reaction or such changes happen nearby the joint, that same symptoms or that same classical features will impact on the particular joint. And this kind of rheumatoid arthritis is commonly seen in a smaller joint, for example, like your hands, your wrists, but sometimes you may also see in your knee. Now, what are the classical features for this or the symptoms? Mainly, it will be swelling, pain, almost similar to osteoarthritis. But the only difference which we can see in among osteoarthritis and rheumatoid arthritis is that in rheumatoid arthritis, basically it will impact on the smaller joint, but also it will be mostly symmetrical, which means if your left side is impacted or affected, your right side will usually be affected. So both sides usually will be affected. Whereas in osteoarthritis, not necessary that both the joint will be affected if it was in the knee also. So it could be only on the left knee or it could be on the right knee. Next up, please. Gout. The next type of arthritis is gout. Gout is one of the metabolic type of disorder when there is an abnormality in the metabolic function in our body. For example, let's say if your uric acid level increases or exceeding the average level or the average amount, which is supposed to be. So that increased amount or that excessive uric acid, which are of a crystal-like structure, will start settling down into the nearby joint. And the most common joint that will be affecting by gout are your big toes, your ankle, sometimes it could be your heel also. So these crystal, the small crystal-like structure, which is of uric acid, they will start getting developed or depositing in these small joint. And when they get deposited in the small joint, definitely because of the restriction and the discomfort, it will start creating pain. But along with the intense pain, there will be swelling in the surrounding joint. There will be a tenderness on the muscle. There could be a limitation in the functional activities. So this is what the gout type of arthritis. The next type of arthritis is psoriatic arthritis. Now, psoriatic arthritis is also one of the chronic inflammatory arthritis, but basically this is associated with the psoriasis. Now, psoriasis is nothing, but it is a type of skin infection. It's a one type of skin infection. So, for example, you have an infection here around your wrist, which is nearby your wrist joint, in the palm nearby your wrist joint. So, this infection, which is caused by, could be of many reasons, bacteria, it could be because of the virus, it could be because of some insect that has been beaten up. So the infection that has created over that region will spread over, including the joint surrounding that area. Now, once it is impacting on the joint, the joint will again start swelling up, but along with that, the other signs and symptoms will start following, like the joint swelling, the redness will happen, the pain will start happening, and there will also be limitation. So as we can see, there will be joint inflammation. Along with that, the skin lesion will be there, since this is associated with the skin infection. The next type of arthritis is ankylosing spondylitis. This is also one of the very common arthritis, which is commonly affecting only the spine. Very rare to happen in other joint, but mainly only in the spinal bone or the spinal joint. Now, this type of arthritis is also an autoimmune disorder, mainly affecting the proximal or the upper spine firstly, but as it progresses or if left untreated, it can spread down towards the lower spine. What are the classical sign or what are the causes for this? Main reason is autoimmune disorder, like I mentioned. So if there's any changes around that particular joint, there will be swelling and all. But the only difference from ankylospondylitis and osteoarthritis that we can see here is that in the joint or the spinal joint, when it affected, the space between the two bones will get reduced. But as the space reduces, the friction of or the contact between two bones are very much prone, from which friction can develop. And when the friction develops, there will be likely chances for the two bones to get fused together or to even join together, leaving a single structure, bamboo-like structure, which we call as. So these are the classical sign or the difference that we can see from the other type of osteoarthritis and the ankylosing spondylitis. Next up, we have a juvenile arthritis. As the name states, juvenile means children. So this is a type of the joint arthritis or the joint inflammation commonly seen in children. Children varies with the age range below 16 years of age. Sign and symptoms is more or less going to be the same, but since this is affecting more in the early age, so as they grow, it will also impact in their developmental system. So it may affect their growth, it may affect their other system as well. So this is what a juvenile arthritis. Next up, please. Infectious arthritis. Now, infectious arthritis is a septic type of arthritis. Let's say if you have an infection at that particular joint, let's say in my elbow joint, I got an infection in my elbow joint. So that infection over the joint will start giving the same sign and symptoms like the inflammation, your redness, swelling, and also sepsis. Sepsis is nothing, but it could be a pus formation within the joint. Since this is an infectious type of arthritis caused mainly because of infection, that infection are likely much to get spread all over the other area. So when it comes to infectious arthritis and the osteoarthritis, the difference is that the progress of the degeneration, as in the bone to get eroded or the bone to get damaged, are more faster here rather than the other type of arthritis. So the same sign and symptom we can see here also. The next up is the reactive arthritis. Now, reactive arthritis is also one type of inflammatory arthritis, which is mainly caused post-infection. For example, like I mentioned before, if I have an elbow infection, the same infection can spread towards my wrist. So when this same infection starts spreading all over the area and reaching till my wrist, the same wrist joint also will start getting impact and showing the same kind of sign symptoms. Like inflammation will happen at the joint, swelling and restriction in the movement. But apart from that, this is mainly seen when you have any other associated problem also, like your urinary tract infection or even your GTI, as in your gastrointestinal infection. Next up, please. The last type of arthritis for today is the lupus arthritis. Now, lupus arthritis is also one of the autoimmune arthritis, commonly caused and affecting the smaller joint like your hand and wrist. Apart from the joint pain and the joint swelling, the common sign and symptoms you can see in lupus is fatigue and avascular necrosis. Fatigue is nothing but a sense of tiredness. So you will feel tired very easily. But apart from that, since it is related to a systemic type of disorder, so it will impacting on the circular system. Next slide, please. Now, osteoarthritis or arthritis in general is not something which we cannot treat. But if we are able to detect it at the earliest, we will be able to even treat conservatively or even through physiotherapy. But if left untreated for a very long period of time, these causes or these condition can lead into a permanent deformity or a permanent problem. For example, as we can see here, the first picture which we can see is of a juvenile type of arthritis. This is where a difference in terms of the alignment of the bone you can see. But because of the difference in the growth and the development that is impacting on the child, there will also be a difference in terms of the length. Now, because of that alignment is not in the correct alignment, the length-wise also will be a lot of, we can see a lot of difference. Next up is the second picture is your gout typhi. Like I mentioned, in gout type of arthritis, the crystal-like structure or the crystal-like uric acid will get deposited into the small joint. So as you can see here, the yellow color is what the crystal uric acid getting deposited into a small joint. Next picture. Next slide. The first picture showing the classical presentation of any joint being impacted or affected by arthritis. So this will be the classical sign. You can see the cartilage coming off, the space between the two bone will be less, and apart from that, the joint fluid and all will start getting reduced or becoming lesser. So this is the clinical presentation seen commonly in all type of arthritic joint. Second picture is what a stoop posture. As you can see in the first picture, that is the normal alignment or the normal standing position. But this stoop back, we can see most commonly when the spine is being affected. Now, spine arthritis is commonly in the ankylosing spondylitis type of arthritis, where your spine arthritis or spinal joint inflammation will happen, and this will give the same kind of the clinical presentation when left untreated. This will be a permanent kind of posture of an individual, which we call it as a stoop back. Next. The first picture is of asymmetrical swelling. Now, asymmetrical swelling, like I mentioned before, that in osteoarthritis, it could be in a single joint or it could be multiple joint. In rheumatoid arthritis, usually both the side will be affected. This kind of asymmetrical swelling will be seen in the infectious type of arthritis. Infectious type of arthritis, when there is an infection on that particular area or that particular region, that whole area, single area will get swollen up. So this is the classical representation when we come to infectious type of arthritis. Next, a picture is of a pencil in cup deformities. This is a common deformity or a permanent disorder which commonly seen in the psoriatic type of arthritis. Now, as you can see, the two image, there's a lot of difference in the structure and the alignment of the bone. So in the first picture, it is a smooth, straight alignment, which is of a normal these fingers bone. Whereas in the second one, because of the skin infection, that infection that has spread all over the bone, the same bone will start eroding, it will start coming off, leading into such kind of the structure. Next. Next up, in the first picture is what an ankylosing spondylitis spine looks like. In the first left picture is the healthy spine, whereas in the second, as you can see, there's a lot of inflammation surrounding that. Red color indicate the inflammation, the swelling, or the injury around that structure or around that area. Worst case, if left untreated, as I mentioned before, that each bone will start fusing and joining to one another. This is how it will look like when it starts joining. Giving us a clinical sign of a bamboo shape like structure, which is why we call this as a bamboo spine, which means when the two bones is being joined, let's say three bone or three spine is joined together, even when you perform the movement will not be in a synchronized way. The whole spine or the whole bone will move together, giving that robot-like kind of movement. So that is what bamboo spine will look like. The second deformity is of boutonniere deformity, very much commonly seen in a rheumatoid type of arthritis, affecting the smaller joint. And this is what will give the permanent kind of alignment of the fingers. Next. The last deformity on the left side is what your knee, commonly seen in the osteoarthritis type of arthritis. The picture in the middle is what your normal knee looks like, whereas in the left side is what we call a knock knee. Now, knock knee is where both the knee will be coming closer to one another, leaving the impression or the tension more towards the inner side of your knee, and giving that bow or knock shape light or the close shape light knee alignment or the structure, I would say. Whereas on the right side is what we call a bow leg or the bony. Bony is what it looks like, the arm and the arrow, the bow and the arrow, which we use it, right? So the same kind of alignment or the posture will give, or the presentation which will give. In this type of deformity, the tension will be falling more on the outer side of your knee. So this is the common deformity which we can see in osteoarthritis. Next, and the last deformity is what we call a swan neck deformity. Swan neck deformity is it's a type of deformity, again, which we can see in those fingers. Basically, the middle part here, the wrinkle part, I don't know whether you can see her as mentioned here. That will go completely down, bend, and the upper part, like the proximal distal area, that will become upper. So this is nothing but a deformity or the alignment of that bone because of the arthritis in the joint. It will give an impression of a permanent deformity in this way. So these are the overall in brief regarding the arthritis and the types of arthritis. Furthermore, will be taking over by Dr. Divya. Thank you, everyone.
Thank you, Dr. Iba. That was very insightful. Up next, we are Dr. Divya is gonna share us about the risk factors, symptoms, the complications, and why early detection matters. Over to you, Dr. Divya.
Hello everyone, I'm Dr. Divya. So I'll be looking on the topics like risk factors, early signs, and why we have to get the diagnosis early. So can I get the video? Can you pause? Yeah. So these are the early signs that you have to look on this. So the first one is stiffness or swelling. This is because of, you know, yeah, thank you. Stiffness or swelling that can be because of accumulation of the fluid. And can I get the video part, please? Mm. Yes. Yeah. So these are the basic early signs that you can see in any arthritic condition. If you feel these kind of signs, then you should take the diagnosis early. And these are the first one is stiffness and swelling. That is because of accumulation of the fluid around your joint. So you can see the swelling kind of thing around the affected joint and reduced range of motion. That is because of stiffness or maybe because of joint space reduction. And then difficulty in aerial activities such as sitting for a long time or climbing upstairs or standing for a long time. Then active inflammation, you may be sometimes you may feel there is a warmness around the joint. That is active inflammation. Then morning pain or morning stiffness whenever you get up from the bed. If you feel morning stiffness, like you can't able to move for around more than 30 minutes, then it is obviously morning stiffness. So these are the early signs that you can notice in this condition, arthritis. Next slide. Okay, so the risk factors, there are certain risk factors that can increase the chances of developing arthritis. Few we can control, but few is beyond our control. So the things we can control by modifying through our lifestyles are age. So age, how does age becomes a risk factor? Age, when a person is older, you have to use your joint a lot. So because of wear and tear of the joint, you may experience this joint damage. So mostly aged after 40, the people are at the risk of getting arthritis. Obesity, when you're overweight, that gives overstress to the joint, because of which there can be damage to the joints, and which can accelerate of the process of developing arthritis. Then repetitive joint stress, there are many occupations or maybe many movements that you have to do in daily life, because of which wear and tear of the joint happens, that in turn results in cartilage breakdown. Coming to family history, we have many autoimmune arthritis like RA that happens because of genes. So that in that way, family history is a risk factor. Like if it's not compulsory, like if our parents or you are having arthritis, so your next generation will have arthritis. But in somehow it in like autoimmune conditions, this becomes a risk factor. Sedentary lifestyle, lack of any kind of movement, may weaken some muscles that supports your joint. Next is poor posture. Any improper posture leads to improper distribution of the weight on the weight bearing joint, which will damage the joints. Apart from this, there are many autoimmune and metabolic conditions like diabetes or thyroid, which will maybe trigger or no, maybe it will increase the arthritis. Next slide. So these are the signs and symptoms we'll look into. Regular joint pain or tenderness, swelling, as I discussed, because of accumulation of fluid around the joint. So the swelling around the affected joint, morning stiffness that you might experience, which will last more than 30 minutes. Reduced range of motion because of joint stiffness, as I explained. Difficulty in performing daily activities like moving or getting up from bed, standing for a long time, climbing stairs, and everything. Then progressive muscle weakness or muscle wasting because of a sedentary lifestyle. Next slide. So coming to long-term complications, joint deterioration is one of the long-term complication. Destruction or erosion or maybe fusion of the joint structures can deteriorate the joint very badly. Bone changes, development of bone spurs. Bone spurs are nothing but bone overgrowth that our body only creates um, because of healing procedure or when the cartilage breakdowns at that time. So bone spurs can be formed and contractures which limits the movement. Then comes to physical deformity, as Dr. Iba explained, the knock knee and the bow knee and the swan neck finger, those kind of deformities and stooped posture can be a long-term complication. Next. So, why does early diagnosis matter? If we diagnose it earlier, we get the treatment earlier, and hence we can enhance the quality of life. So, first one is prevent joint damage. If we get the treatment earlier, it may stop or maybe slow down the structural damage that can be caused to the bones or through the cartilage. Improve functional outcomes. You can be independent. You can do your own work on your own without any help, without asking and for any assistance. Then slowing down the progression. You can delay the advancement of the arthritis, and you can do the activities for long time without any help or something. Then cost effective, of course, if you diagnose it earlier, you will get the treatment earlier, and you can reduce the long term healthcare expenses and avoid costly interventions like surgery. Yeah, that's all from my side. Thank you, everyone.
That was very insightful, Dr. Divya. You have clearly defined why we need to diagnose early and what are the clinical signs and symptoms that we need to look for. As we say, prevention is better than cure. So this part is so very important for all the viewers, I believe so, and hope you are understanding. Next up, we are coming with medical and physiotherapy management and lifestyle management. What are the things that you can do to prevent or manage the osteoarthritis in long run? So to present that, we have Dr. Samhita. Over to you, Dr. Samhita.
Good afternoon, everyone. I hope I'm audible.
Yes.
Okay. So we've already learned about what are the causes, what are the different types of arthritis, and what are the signs and symptoms of the arthritis. Now, next for us to know is the management part. So management is categorized into medical, physiotherapy, and surgery. So the first one is the medical management that the patients receive through the orthopedics mostly. So in this again, we have four classes of treatment. The first one is the non-steroidal anti-inflammatory drugs. So as we know, in the arthritis, we have pain and inflammation, which are the classical symptoms. So these class of drugs take care of those symptoms that you're experiencing. It will reduce the pain, it will reduce the inflammation. The second class of drugs that we have are the disease modifying anti-rheumatic. This is mostly given in patients with rheumatoid arthritis to delay the progression of the disease and to prevent the extensive joint damage that happens with the condition. So these two again the effects will last a little longer than the next two that I'm going to discuss. So the next is the corticosteroid injections. Again, when the pain and inflammation is too much that the pain, it is not reducing with the drugs, that is when the orthopedic would want to progress to a little more invasive technique where they inject corticosteroids into the joint. The effects of this injection will last for a few weeks to a few months. The next most common that we see is the topical treatments, that is with the pain gels, the pain patches and creams that they use. They also again have these NSAIDs that I mentioned. So the idea is to reduce the pain and inflammation again. So when most of the patients that we get would have already gone through the medical management, and maybe if they did not reduce to such an extent, then they would refer for a physiotherapy. So what does physiotherapy do? What do we take care of? So what are the goals of physiotherapy in osteoarthritis is first thing, we relieve your pain, we relieve your stiffness, and because of the condition, there's a lot of impact which is fallen on the muscle surrounding the affected joint. So the flexibility and the strength will be improved, and in general, your physical function and your dependence is more. Your physical function would have reduced, and the dependence on somebody else for your activities also happens over a period of time. So that slowly comes back because we take care of the pain, stiffness, and the muscle strength part. So along with all this, the whole idea is to reduce the occurrence of a surgery, the requirement for a surgery. So we delay the surgical process. Next, please. So in physiotherapy, we have three main parts. First is the treatment modalities. The second one is the exercise therapy. And the third one is the techniques which we do to take care of the stiffness that is associated. Coming to the pain relief part. So when there's a chronic osteoarthritis, that is you've had pain for more than 3 months, there's a lot of desensitization that has happened, which is why you feel pain not just in your joint, but surrounding areas as well. So there is hyperactivity within the particular joint. That is why your brain is receiving constant signals that there is something happening there, which is why your pain increases. The sensitivity to pain is also more. So for that, we use modalities like IFT, ultrasound, TENS, and laser, which most of you would have heard of. So the reason for us to use this is to reduce the discomfort and the pain that you're facing through block. So what does this do is it will block the symptom, it will block the signals that is going from the joint to the brain. That is the brain constant stimulation will start coming down with this technique. Next one. So as the physiotherapy treatments are advancing, we have two major parts of treatment that is the most effective in the current times. So one is the cupping and one is dry needling. So cupping and dry needling are a little invasive. Cupping is not very invasive, but when it comes to dry needling, it's a little invasive technique. So where cupping is done when there's a generalized stiffness. So say you have stiffness overall in this region. When it is not localized, you have generalized stiffness in the entire region. That is why you put the cups in the entire region and you leave it for a certain amount of time. And when you release it, there's a lot of blood flow that is induced within the particular area. That is why that will flush out all the inflammatory cells and promote healing. The second one is the dry needling. So after cupping, probably 2-3 sessions of cupping, when the stiffness has come down a little and it is localized to the particular area. So say there was stiffness here and now there is stiffness only in these regions. So what do you do is we put a needle in the particular areas after palpation, of course. So we put a needle in those particular areas where there's a lot of muscle tension. So when we put a needle, it will slowly start stimulating the knot or a tension point that is formed to start releasing. So the muscle which has become like this will slowly start relaxing. That is how the joint mobility and the flexibility of the muscle also starts reducing, and the tight muscles will start relaxing. Next, please. Next, the mainstay of treatment for any osteoarthritis is through exercise. But of course, when a patient comes with you with a 10 on 10 pain, you can't directly start exercise. You'll have to look at the other aspects to make the patient more comfortable, reduce the pain and stiffness that is presenting. Only then will they be able to do a few exercises comfortably. So exercises again will have many types. The first one is the range of motion exercises. Say if this is your range, but with osteoarthritis, you have only this much. So for us to completely get this back, we'll have to keep practicing this. So general that is the complete range of motion of that particular joint. So we boost that so that your joint mobility improves. That is the first one. The second one is the gentle stretching. So once the tightness and the stiffness in the muscle has considerably come down, we have to maintain that. So it is very vulnerable, so it can go back to the contracted state. So for us to maintain that is through stretching. So the stretching to the particular uh, muscles surrounding the affected joint has to be done. So we prescribe that. So once the joint mobility has come back and once the flexibility of the muscles have improved, then only we can start strengthening. So before the complete range has come back, if there is only half range of motion, and you start strengthening exercises beyond that particular range, it will further force the muscle to contract. So within the mobility, whatever you regain, you can start strengthening. But the mass strengthening that you do for the entire muscle, you'll have to we'll have to wait until the mobility improves and the tension in the particular muscle comes down. So that is with strengthening exercises. This can again be done with weights. As you all know, we have weights like we start with half kg weight, then progress to the higher weights based on the tolerance of the patient. We also have different resistant bands. The colors depict the amount of resistance they provide. And the last one is the low impact aerobics. Say if you have knee osteoarthritis mainly, focusing on knee osteoarthritis. So when that time, if you don't move, if you further restrict yourself, it is only going to worsen the condition. So as a low impact aerobics, we prescribe gentle level walking for probably say start from 15 to 20 minutes and then progress based on how the patient is presenting. Next one. So apart, just physiotherapy, just medications will not really bring about very good difference. So you'll also have to make a lot of lifestyle modifications and with respect to your diet as well. So any osteoarthritis will heal better if it is a combination of all the techniques. So for first one is to stay active and maintain a healthy weight. So any cartilage does not have a blood supply. So if you have good blood supply, you can heal better. So since cartilage does not have a blood supply, it gains nutrients and supply only through movement. So if your knee is injured, if your knee osteoarthritis has set in, you have to move a lot. The more you move, the more you walk, the better the nutrients go into the cartilage and it starts healing. So movement is always advised in any type of arthritis. Of course, in the starting stage, we'll have to take care of other things. But once the patient has started improving, we always ask them to take active rest, not complete bed rest. So give sufficient rest to the joint that is affected, but don't completely restrict yourself from doing movement. Second one is the healthy weight. Like Dr. Divya said, maintaining a healthy weight ensures that there is not excessive force falling on the joints. So based on your height and weight, you'll have a particular BMI range that you fall in. Maintaining that is very important to prevent the arthritis from becoming more, especially in case of hip and knee. Next is your anti-inflammatory diet. So not just if you just take the anti-inflammatory drugs, it might not really give good relief unless you cut down on the diet which is rich in inflammatory content. So preserved food, processed food, sugar, and all that has to be cut down, and you have to consume more of fruits and vegetables and whole grains. Next is supporting your body needs. You have to get a good amount of sleep, 7 to 8 hours, and at least for your bone to start remodeling and feel better, you need some amount of vitamin D. So a few minutes in the sun and drinking at least 2 to 3 liters of water every day is also important. And once we start teaching you exercises and try to correct your posture, maintaining that is very important. So if you have knee osteoarthritis, for example, you've seen many patients walking sideways. They don't climb up stairs like this or climb down like this. They turn to the side and go up and come down. So that is going to put a lot of strain on your other leg and on the spine in general. So the use of assistive devices like walkers, canes, sticks, and all that has to be, we educate you on the importance of using all that to prevent your other joints from getting overstrained. Next. So what are the do's and don'ts to summarize? So for the do's, you have to wear supportive and well-fitted footwear. So if you don't wear a well-fitted footwear and there is, if you're using a very old footwear and it has unevenly worn out. So if your footwear is like this and this part of your footwear has worn out, there's a lot of pressure falling on this side and on that same side of the knee. So that is going to put extra stress on your knee joint and further it will progress, the condition will progress. So it's always advised to use a not just knee osteoarthritis, even with your spine. So to align all the forces, you have to have a very good support that comes through footwear. The second one is if you see any of the early signs that we've mentioned in this PPT, in this webinar, please go get regular checkups and keep a track on the progression of your disease. It's always advised to go back to your physician and ask him what is going on and if any other medication or if any other exercises for your regimen has to be added. The third one is any condition will flare up if you're stressed and if you're constantly overstimulated. So you have to practice a lot of relaxation and try to keep a check on your stressors. Next is we've seen many patients who, once the pain has become so chronic that they avoid going to certain places and avoid mingling with others. So the more you do it, the more psychologically you're putting yourself down. So try to maintain a healthy relationship, say, be it at home, be it with your friends or in a social gathering. So try to indulge more of those. And whatever we say completely depends on you. Whatever your progression, your prognosis depends completely on you. That comes through following whatever we say, following whatever the physician says. So if you do whatever we advise, there's a very good chance for you to get better. So that is the most important thing that you have to do to keep a check, because once joint osteoarthritis has set in, you can't reverse it. The only thing you can do is to delay the progression. So for that, you have to listen to your physio, you have to listen to your general physician. What are the don'ts that you shouldn't do? Like I said, maintaining a healthy weight and being active is one major thing. So avoid prolonged inactivity or avoid completely resting. Active rest is advised, bed rest is never advised. At least in the once the physio has been started. Next is the avoiding joint overexertion of your joints. So enthusiastically, once you start getting better, you might want to do more of it. To some extent that works, but if you completely keep doing it over and over again, and if any exercise is wrong, that can impact the surrounding and the adjacent joints as well. So don't overdo it and don't underdo it. Maintain a complete balance and listen to what your physio says. Next is the self-medication. Of course, many people usually consume drugs when the pain has become so much that they're not able to tolerate. So instead of self-medicating, go to your physician and check what is going on. And like I said, don't ever ignore the early warning signs now that you're aware. Next is the again repetitive has to be reduced so that your progression is steady. Okay. Coming to the last part to summarize what all we covered. First one is the early recognition. Early recognition is through the early signs that are happening in the body or in that particular joint. So that will prevent listening to the early signs, getting it detected will delay the progression of the joint and preserve your joint health. Second one is the multidisciplinary approach. So just physio, just medication will not help. Use a combination of everything and keep coming for regular follow-ups so that we can change your exercises and then look at what is more important and make the necessary changes and give you a tailored program. So I hope you had a interactive session, informative session. If you guys have any questions.
Thank you so much, Dr. Samhita, for describing it so well, the medical and physiotherapy management. What are the do's and don'ts? What are the lifestyle modifications that people can do to prevent and manage arthritis? So over to everybody now, you can ask the questions. We will all take up your questions. Just let me know. You can just unmute your mic and tell your questions.
Excuse me, I have a question, doctor.
Yes, ma'am.
Actually, I want to know whether there's any connection with arthritis and frozen shoulder.
Mm-hmm.
I used to come to Healing Hands for my frozen shoulder. So I just wanted to know if there's any connection between the two.
Yes. Just a second. Who's taking up the question? Eva?
Okay. Osteoarthritis is basically an inflammatory or an inflammation on the joints. When it comes to frozen shoulder, I won't say that there is no inflammation at the joint, but the main reason is not because of the wear and tear, which is related to age, but it is the destruction at the capsule or the cartilage that is surrounding the joint, more or less similar to osteoarthritis. But as such, it is not related because frozen shoulder is a disorder or a different type of shoulder condition, whereas arthritis of the shoulder can happen. Now, arthritis of the shoulder can happen at the joint, whether at the glenohumeral joint, because the shoulder joint itself is a complex joint. It's not a single joint. So there are many joints surrounding the shoulder as well, which can be affecting your AC joint, your acromioclavicular joint, or your glenohumeral joint. But as such, frozen shoulder is not related or it is not similar to osteoarthritis. But because of the arthritis, it can lead to frozen shoulder. That is the difference.
Yeah,
Yes, frozen shoulder can be because of many things, as she has rightly explained. So it is a type of arthritis, yes. But frozen shoulder, it's more of like, it becomes a constrictive thing, and the joint becomes really tight, and it could be because of many other reasons.
Yeah. Can I just quickly ask two more questions?
Yes, please.
So when you say early diagnosis, what exactly do you mean? What are the kinds of tests you will do if you go for a medical checkup?
So when you come to physiotherapy, we can definitely do a range of motion test. We do the palpations to detect where exactly the pain is coming from, how bad is the pain. We also check the muscle strength testing and all of that. We also do a little bit of testing. How well is the joint moving and all of that. So your pain, range of motion, and inflammation, all these things, when we check, we have a clear-cut idea about at what stage your arthritis or the problem is in, and then we can do the right targeted treatment, specifically customized to your condition.
Okay, one more, just a last question. What can we do about bunions on the feet, and sometimes the middle toe is sort of bumped? Does all that have anything to do with arthritis? Is there anything we can do about it?
Yes, so bunions and all is a type of this thing, again, arthritis that
Deformity.
happens majorly deformity because of so that itself is a condition, but it happens because of uneven weight bearing on the toes. So
Okay.
if you detect it early, it's very easy to correct it. But once the deformity has happened, it's a little difficult. There are some bunion, correctors and all of
Correct.
that things are available, but that is not going to give you a very good result, a very good progression over a period of time. If detected early, when it is just starting to happen, that's when we can do a lot of things. We can so why bunions happen? Because of the it may be because of the glute getting tight or glute getting weak. If the glutes are weak, if the core is weak, the pressure on the legs fall in a very different angle, and because
Okay.
of which your foot arches collapses. Foot arches collapses again. Your weight is going towards the
Oh,
medial side of the inner side of the foot, and that is why that thing happens. Also, it happens because of the inappropriate footwear.
okay.
Sometimes we use a very narrow toe shoes, because of which
Right.
also it forces our toes to go
So,
inside, and that puts a lot of pressure on the toes,
okay.
and these are the reasons for the bunion as well.
Okay. And any calcium intake for people above 50, will it help in all these bone related things? Calcium
Yes, yes,
intake.
yes. Calcium, we all should have. So excess of calcium is a problem again, but
Right.
we should get a regular checkup done. And if at all there is a little bit of deficiency, we should take it as a precautionary measure. So it's always advised to get a blood checkup done, and only then you start with calcium.
Okay. Thank you very much. Thank you, doctors, for
Thank
all
you.
the information.
Thank you, ma'am. Anybody else has a question, please unmute your mic and you can ask the questions.
Yeah, I do have a question.
Yes, Rahul.
Yeah, how much help does it? How much it does help when we use orthopedic pillows, mattress, or shoes?
It is a very important question. As a young person, we should try to avoid anything that can lead to arthritis later in our life. So all these things, the posture. So we sleep for around 7 to 8 hours every day. And if the mattress is sagging, if the pillow is not right for us, we are not gonna get a good night's sleep first. Second is, over a period of time, our spine is not going to be in alignment. It's gonna be like, stoop posture and all of that. So it's very important to pick up a right mattress, right pillow for you, so that you can avoid all these. It could not it doesn't have to be arthritis all the time. Even if the muscles are getting tight over a period of time, it can start putting pressure on your spine and all of that. A lot of other things can happen. So yeah, I would recommend a good orthopedic mattress. Spring mattresses are usually, I say, generally to avoid, because spring mattress, only if you go in a higher end spring mattress, then it comes good. But uh, if you have gone in and stayed in some hotels, you would know, like, when you wake up in the morning, you have all these aches and pains and all of that. So it is comfortable to sit or maybe just relax for some time, but not really good for overnight sleeping for a long period of time.
So these are
Maybe
not just marketing gimmick.
these are not just marketing gimmicks, though there are a lot of marketing gimmicks available. So we should really know, we should know what is real and what is fad. Very important for us to know.
So can we sleep on hard surfaces for like back pain or?
If you have already back pain, I would not suggest, but generally it is okay to sleep on hard surf. Hard, I would say firm.
Okay.
A little bit of cushioning should be there. It should not be too soft, it should not be too hard. It should be like firm, somewhere in the middle, where your spine is relaxing, your bones are not getting, pressure points and all of that. Yeah, that's very important.
Yeah, thank you.
Thank you so much, Rahul. Anybody else would like to ask some questions. All right, then. That brings us to the end of today's session. I hope you found it helpful and it gave you a clearer picture of how arthritis can be managed naturally with the right approach. If any of you have any questions, you can definitely message us and we will get back to you. So, a big thank you to all the Healing Hands team for taking initiative and sharing their knowledge, and to all of you joining and making this session a very interactive and effective. I would personally like to know more about your condition if you have certain things. So you can book a consultation with us and feel free to reach out to us at any time. We are always there to help you on your healing journey. So you can book by calling to this number, which you can see it on the screen. I am sure you all have this number already. So thank you for joining us. Stay healthy, stay pain free, and keep moving with healing hands.